We are encouraging all residents or their families, for those that have not provided consent, to reconsider and to bring themselves forward. Around the country, we've seen 85% of residents in residential aged care facilities and 100% of Victorian residential facilities vaccinated so far. But we want to see as many of those residents who have not chosen to be vaccinated, or their families where they are providing the consent, to consider the absolute importance of vaccination. It can save your life. It can save the life of mum or of dad or of grandma or grandpa. So please do that. We would also note that the Victorian Aged Care Response Centre has taken immediate actions. A clinical first responder is in place. Testing is underway for all staff and all residents. As the Victorian government has said, the highest level of PPE is in place. Surge workforce is being made available. So all of the steps which can be taken to keep the residents safe are being taken. But we will follow very closely, but we are thankful for the worker for having consented to be vaccinated. We are thankful to the worker for having come forward for testing so soon, and we are working in partnership with the Victorian government. I'll invite Professor Murphy, then Michael Kidd to speak.
Thanks very much, Minister. I was delighted to get my second dose of the AstraZeneca vaccine today. For while we know that the first dose actually provides really good protection, the best and most durable protection comes from finally getting that second dose after 12 weeks. It does take a long time between the two doses, so we're now going to start seeing a huge ramp up in the fully vaccinated population as the AstraZeneca vaccine second doses start. And I do encourage everybody eligible, particularly those over 50 eligible for AstraZeneca, to come out and get vaccinated. I particularly want to address today a message to those over 70. The reason being that people over 70 are those that have the highest risk of dying from COVID. One thing that this Victorian outbreak has taught us is that we are not immune from COVID. We will continue to see outbreaks, even with a really good public health response which Victorian authorities are introducing. People over 70 have probably a greater than 10% chance of dying if they get COVID. We have vaccinated already more than half of our over 70s, but there are many left to go. If you think about the anxiety some people have felt about the very, very rare clotting disorder, that occurs in about a little over 1 in 100,000 people. Your risk of dying from COVID, if you're over 70, is 1 in 10. It is 10,000 times more likely that you will die from COVID than you would get this rare clotting condition, which we know we are picking up early in Australia, and particularly in the elderly, it does seem to be, in most cases, a mild condition that's treatable. The risk of dying from COVID is very, very high when you're over 70 and continues to increase. So I say again, the risk of dying from COVID is 10,000 times more likely than the risk of getting that rare clotting condition. So please, please turn up and get vaccinated. All over 50s, but particularly those older people over 70 who have an increased risk of severe disease and death. Thank you.
Thank you, Minister. Thank you, Brendan. I'm very pleased today to have received the first dose of the AstraZeneca vaccine and to join with the millions of Australians who have lined up to get their first doses of this vaccine. This is an incredibly important contribution towards protecting our own lives, the lives of our families, and of course our contribution towards the health of everybody here in Australia. One of the things which I was given was the handout from the Australian government, both on preparing for the vaccine but also awareness about possible side effects which may occur following the vaccine. And I've read that, and I encourage you, when you have your vaccine, to read it as well, to know what to look out for, and just to be sure. My message today is we are, of course, experiencing outbreak of COVID-19 in Victoria. Incredibly important that anybody who has any symptoms of cold or fever or flu, no matter how mild, goes into isolation and arranges to get a COVID-19 test. We have had some complacency in Australia in recent months. I think that what we're seeing happening in Victoria is a really important lesson to people right across Australia that we cannot be complacent about COVID-19. The pandemic is still with us. We need to do all we can to protect the health of our loved ones and the rest of the country. Thank you.
Thank you. I'm happy to take any questions. I'll start in with Shupa from SBS.
Thanks, Minister. James Merlino says he's beyond disappointed in the federal government for not providing financial support for Victorian workers. He says he's asked the federal government multiple times and the unrelenting answer has been no. Is James Merlino right to be disappointed in the federal government, and what's your message to him?
We welcome the Victorian support. We think it's appropriate under the circumstances. It builds on the $45 billion which the Commonwealth has provided to Victoria, far and away the highest per capita economic support to any state or territory. It's, I think, supplements the $13 billion which Victoria has put in place. We have 4 ongoing measures, as an example, which are supporting Victorians. One is the pandemic leave disaster payment of $1,500. 2 is the National Health Emergency Crisis Payment. 3, of course, there is the ongoing business support of the loss carryback program for any business which may make a loss during the course of this financial year, where they can receive a rebate against profits from previous years. And then, of course, there are the immediate expensing measures. So those are our ongoing supports, and we think that the Victorian response today is fair and appropriate, and we acknowledge and thank them for that. If I may, I will then go to...
James Merlino says that's not good enough, and he slams the federal government. What's your response to that?
Just the one that I've given. Thank you. I'll then go to Rob at Channel 7.
Thanks very much, Minister. I just want to get your reaction to Nick Coatsworth's call for people under 50 to be able to get AstraZeneca if they've been properly informed of all the risks.
Look, I'll invite the Deputy Chief Medical Officer to talk about that.
Thanks, Minister. So we're following the advice of the experts on ATAGI, the Australian Technical Advisory Group on Immunisation. As you'll be aware, the recommendation from ATAGI is that Pfizer is the preferred vaccine for people under the age of 50. Thank you.
Great. If I may, Majura from the Courier.
Oh, thanks, Minister. Just on, I understand that, about 98% of all residential aged care facilities have now been visited by in-reach vaccine clinics. But how many aged care workers have been vaccinated? And further to that, how many people in disability care have been vaccinated, and how many people who work in disability care have been vaccinated as of today?
At this point in time, it's actually 99% of facilities nationwide, with the final facilities to be done in the coming days. Secondly, it's 100% of Commonwealth residential aged care facilities within Victoria. The aged care workers and disability numbers all up are 345,566 across the different categories, with over 9,000 resident doses and over 3,000 doses for disability workers, and over 70,000 aged care workers. But that's on direct in-reach, with many additional ones having gone specifically to GPs and Commonwealth respiratory clinics and state respiratory clinics. So that reconciliation is additional work which is ongoing. All right, so then if I may, Jade.
Thanks, Minister. In regards to the aged care worker who tested positive in Victoria, what vaccine was given to that staff member? And do you conceive that if the rollout had have been faster, residents at that facility would have had greater protection right now? And just on supply, Victoria says it only has 20,000 doses per day that it can sustain. going to further increase the supply of doses to that state?
So on Victorian supply, there are 787,000 doses that the Commonwealth has provided to Victoria. They have delivered 460,000 doses. So just to repeat, the Commonwealth has provided 787,000 doses to Victoria. They have delivered 460,000 doses. We're providing an additional 171,000 doses to Victoria over the course of the coming week, and an additional 90,000 doses to general practitioners in Victoria. So there are very significant supplies, and we thank them for their work. We think they're doing an excellent job, and as you will see, there is very large and significant inventory available within Victoria. In relation to the program, I think the fact that we have had 100% of facilities, Commonwealth facilities within Victoria, which have been given the vaccine program, means that that's a very, very important protection, exactly as Professor Murphy has set out.